Government-assisted suicide is back at the top of the news in Canada. It's now been discovered that in Canada, part of their MAiD program, the Assistance in Killing Its Citizens program, the Trudeau government apparently has been lying about the number of people who are actually killed through the MAiD program. They lead the world, by the way, in euthanasia. We also have another angle to this story, a woman who was basically assigned as part of the MAiD program to be killed in Canada, managed to get life-saving surgery by crossing the border into the United States. And now she's okay. So she would have been killed in Canada, went to the United States and was saved with life-saving surgery. So what is going on with these numbers? What is Canada trying to hide? David Krayden, who writes at the Post Millennial, has been covering this story extensively, done a great job, and joins us now. David, good to see you. So first of all, let's start with the numbers piece of this. Their numbers were already astronomical. I mean, Canada leads the world in assisted suicides, and yet they're hiding numbers?
Well, Stats Canada, which is Statistics Canada, and I'll tell you a bit more about them in a minute. But they have revealed on their own website, this is the beauty of this, if you will. They're so proud of their deception that they put it on their website. And StatsCan revealed, and I'll read it exactly, what they have done in terms of reporting the data for the medical assistance in suicide. That's Canada's euthanasia program. No bones about it. It's a euthanasia program. And it says, quote, in the database, the underlying cause of death is defined as the disease or injury that initiated the train of morbid events leading directly to death. As such, MAiD deaths are coded to the underlying condition for which MAiD was requested. So to break that down into common English, it's saying they're going to report MAiD deaths based on the reason, the medical reason, if there is one, that somebody decided they wanted medically assisted suicide. Now, two questions come to mind. How long has this been going on? Are the numbers already corrupted? Or is this from now on? They're going to be reporting this because the numbers are horrifying. For the last year that we have numbers for, which is 2022, 13,200 people committed suicide through the MAiD program. The year before, over 10,000. Now, what are the numbers for this year? Well, certainly more than 13,000. They're escalating. So we're looking about at least 35,000 people who have sought suicide through Canada's euthanasia program. But my question is, again, are they fudging the numbers up till now? Or are they saying from this point forth, we're going to be fudging the numbers? Because clearly this is the Canadian government trying to hide the numbers because you have reported, I have reported, there's been documentaries reporting that Canada is the suicide capital of the world. It's the assisted suicide capital of the world. People are literally coming to Canada to die. I don't think the Trudeau government likes that kind of information being public. I don't think the Trudeau government wants that to be out there in terms of Canada and its tourism industry. Right. So I think there's a concerted attempt to hide these numbers.
I can imagine flying into Toronto or Ottawa at the airport, and normally you see all the flashy billboards for the things that you're going to do in that town that day. You're going to go visit this building, this historic church. You're going to go all see. Instead, Canada can have billboards that, well, you're here. You might as well pick out your coffins while you're here because that's part of their tourism industry. Essentially, is people are flying in to be medically assisted in death. What I'm struck by, have they gotten back to you? Have you managed to get any kind of a response from them on this? Are these numbers? Is it going forward that they're going to start to fudge these numbers, or historically this has always been the case? They've been fudging these numbers. Has anyone responded or given you any indication that they plan to answer your question on this?
No, they have not. I've got a query in, and I will be expecting an answer on this. But certainly it's an outrage. And what really should concern anybody is that by doing this, they are replicating the behavior of Nazi Germany. Because Nazi Germany had an extensive euthanasia program for anybody unfortunate enough not to be perfect. And if you had any kind of physical deformity or mental incapacity in your family that was genetic, you were eligible for Nazi Germany's euthanasia program. Step right up, and they would take you away in the night. But they reported those deaths as anything but euthanasia. Common cold, influenza, pneumonia, cancer, all of those deaths were attributed to something else. And that to me is absolutely frightening, that we have a Canadian government that is directly lying about why people are dying. And it's the opposite. It's the opposite extreme of what they did during COVID. During COVID, everything was COVID. You
Right. I was
went to
just
the
going to
hospital
say,
and died.
I was
Yeah.
going to say, because you could be in a car accident and a violent car accident and die. But if you had COVID, it was death because of COVID. I mean, that's literally how they were marking things. So this is a stunning kind of turn and moving away from, well, we're giving them a shot and we're killing them, but they're dying. They've actually died because of cancer. Or, well, we now know in Canada, you can sign up for the MAiD program if you're mentally depressed. So can you now, I guess now technically under this fudging of the numbers, you could die from being medically depressed or medically anxious. So anxiety will now become a cause of death in Canada, or depression will now become a cause of death in Canada?
Well, that's precisely what could happen when you lie about why people are dying. This is a horrible program, and there's no way to gloss it or sugarcoat it. It's about killing people. Yes, they might want to at the moment, or you can say they want to. I don't know how we're going to do that with mentally ill patients, how we can possibly prove that. But it's about people being assisted in dying, in committing suicide. It's not about them dying of cancer. That's really why they're dying.
So tell us about Allison in Canada. This is an amazing story, and it's part of this medical assistance in death, the MAiD program story. She had cancer, abdominal cancer, in British Columbia, and well, you walk us through what happened to Allison.
It's a fascinating story, and I'm happy to say that there is a happy ending to the story. Not thanks to Canada, though, but it's Alison Ducluso from Victoria, BC, and that's on the far west coast of Canada. And she was diagnosed with abdominal cancer only because she wound up in emergency one night. Because as far as the doctors were concerned, she really couldn't see a doctor. So she ended up in emergency because she collapsed. Then they said, well, the reason you collapsed is you have fairly well advanced abdominal cancer. Subsequent examinations revealed it was stage 4 cancer. She had from 2 months to 2 years, probably a lot less than that, to live. So while she was desperately trying to get treatment in Canada, to get an operation, because she needed help immediately, what did they offer her? Not assistance through the British Columbia Cancer Agency. They said, well, you know what's available, Allison? The medical assistance and dying program. If it's just too much for you, we'll offer you suicide. And she mentions this in an aside, like I went to get help and they offered me MAiD instead. And it's just she's aware of the irony. She's aware of how horrible this is. How can they do that? And yet the publicly funded healthcare system Canada, Medicare, the socialized medicine program that Justin Trudeau is always bragging about, that a lot of American politicians are bragging about. Bernie Sanders loves to brag about socialized medicine in Canada. It completely failed her because it could not save her life. She would have been on a waiting list probably for years. She had to go to the United States to get the cancer removed, to have the life-saving operation, because Medicare failed her. All they could offer her was suicide, not life. Thank God she's well today. But my God, she's a critic of Canadian Medicare because she's saying there's something horrible about this system.
Yeah, I guess socialized medicine in Canada is not all it's cracked up to be. And maybe United States politicians should pay attention to that. Well, I'm glad that she did not take them up on their offer at the MAiD program. And I'm glad America could do something great and prove that its medical system can stand and shine like a beacon of hope at some stages and help people. That's
well,
great.
I mentioned Bernie Sanders, Clayton. He had a life-saving operation some years back, emergency heart surgery. I don't know if you recall that. He was running for presidential nomination. I wrote an article at the time for the Daily Caller, where I was the Canadian bureau chief, and I said Bernie would have died in Canada because the waiting list for that kind of operation is 6 to 8 weeks. He didn't have time to wait. And here's Bernie always praising Canada's Medicare system as being just so wonderful. It would have failed Bernie Sanders because 65,000 Canadians every year leave Canada for the United States to get health care, to get life-saving operations. Allison's not alone, 65,000. And Canadians pay $12,000 a year minimum in their taxes to pay for their so-called free Medicare in Canada. There's nothing free about it. It's cheaper to get private insurance than it is to pay for because the richer you are in Canada, the more you're paying for your Medicare and taxes. So it's not free and it doesn't work.
Interesting. I didn't know any of that. That's fascinating. Wow. That's an unbelievable statistic, and one that, of course, they don't want you to know about. The Trudeau government doesn't want you to know about it. Absolutely. No wonder they want to fudge these numbers and hide everything. David Krayden, great to see you. Great reporting on this story. Fascinating. Glad to hear that Allison is okay. And yeah, keep us posted on these fudging numbers and what you uncover, because I think this is just the beginning of the onion to be peeled here. So thanks, David. We appreciate it.